symptoms I tend to see are bloating, I would say, and constipation tend to be some of the bigger ones. So it's often women who have perhaps always had a little bit of IBS and it's exacerbated during the perimenopause, or another one that's becoming a little bit more relevant is histamine intolerance, which I'd love to touch on a bit more later down in the talk. And then, you know, increased kind of gut sensitivity, which all women can struggle with, especially into the perimenopause. So I guess out of all of the gut symptoms, I do see a range of them into perimenopause, but the bloating tends to be one of the biggest complaints, and the constipation. So I think one thing that I would really like everyone to take away is that although it's really common to see kind of gut symptoms or changes in gut during the perimenopause, it's also really important not to assume that it's due to the menopause, and to have to rule out other conditions first, because a lot of conditions that kind of present similarly, like celiac disease or inflammatory bowel disease, which are both autoimmune conditions, they can occur at any point in your life. So it's still really important to have other conditions ruled out before we look at changing the diet and assuming it's due to just the menopause, or looking at other things too.
Absolutely, especially at the moment, because every day a symptom of the menopause is added. I think we're up to 48 now, and every day it goes on. So we still have to be really careful not to make assumptions in terms of causal links or correlation. Actually, you just touched on, and when we had our teaching session with you, I thought it was really interesting that you distinguish between upper and lower bloating. Would you mind telling a little bit more about that and what the difference is?
Absolutely. So I always like to ask my clients where they feel the bloating is, because that can really affect what we're going to do with the diet. So your kind of higher up bloating towards your rib cage is associated with the stomach. So it's usually, when we're looking at the diet side, it's things like your meal size. So if you're having a bigger meal, it sits in your stomach for longer and it's taking longer to process and go through. Or it's also due to things like meal timings and how well you're chewing your food. So if you're chewing your food quite quickly, or not chewing, you know, if you're eating very quickly, eating at your desk, then again, food will sit in your stomach for a little bit longer. Whereas if you're taking your time, eating mindfully, and really chewing your food into a paste, you're releasing enzymes in your mouth to help you digest that food. And because it's already in more of a paste in your stomach, it will then kind of go through a little bit more quickly. So your upper bloating is more likely linked to meal size, meal timings, as well as composition. So things like fat stay in your stomach longer than other types of foods. And your lower down bloating, that's kind of belly button and below. Sorry, I'm kind of looking, but I realize you can't see my stomach. Belly button below is more likely bloating that's due to kind of fermentation or gas. So that might be due to things like FODMAPs, which again we can touch on in a little bit more detail. And sometimes it's kind of all over bloating or distension, which is again another kind of subset. So bloating is that gaseous tight feeling, and then distension is the visible increase in size of your stomach as well.
Yes, and of course, as health and fitness professionals, like physios and fitness professionals, this is often something that women come to with us. And you know, that sort of typical bloating, there may be a diastasis post-pregnancy as well. There might still be there into the menopause. But of course, that bloating, if it's related to gut health as well, it just gets so much worse towards the end of the day or after a meal. So they may sort of feel they're fairly flat in the morning, and then in the evening they feel they look like they're 6 months pregnant.
Yeah, absolutely. And I think that timing that you mentioned is really key as well, because sometimes the bloating can be, if it's in the perimenopause, it can be due to like water retention and hormones, and sometimes it's due to an exacerbation of, you know, gas or SIBO, as you kind of touched on earlier. So this is bacterial overgrowth, where you get bacteria moved from your large intestine, where we want it, up into your small intestine. And if that's the case, there's dietary and antibiotic treatments you can look at. And that's often if you get bloating really quite soon after eating. So within an hour is one of the kind of most typical symptoms of SIBO. So there's so many different, within just that bloating section, so many different questions you can ask, and so many different kind of paths it leads you on.
Absolutely. That's and that's why you need to talk to a healthcare professional, really, if you've got any questions in terms of if it's impacting your general health. So going back to always my favorite subject, and that's bowel movement. There's quite a lot of debate in the medical world what's normal, sort of normal bowel emptying. And I think as women's health physios, we have quite a specific thought process around that, because we treat women with prolapses and we don't want things to get stuck because it's really, really miserable. So in terms of frequency and form, what are your thoughts and experiences, and how do you work with your clients?
Yeah. So I know we touched on this the other day as well, and I think it's really difficult to generalize for everyone. So if I'm speaking to kind of the general public or people who are have no pelvic floor issues, etc., then I would usually say kind of anywhere between 3 times a week at the lowest end up to 3 times a day at the highest, which I know is slightly different from how you work with your clients. But I think the most important thing is also kind of ease of passage and how well formed that stool is. So ideally, in terms of good gut health, you want to have quite a sizable stool. So kind of 2 egg sizes or above is associated with better gut health, lower risk of colon cancer. And then what you want is also kind of a stool which is quite well hydrated, quite smooth, quite easy to pass. So not too much kind of incomplete evacuation or wiping, not too much straining, those kinds of things, all really important to look out for, as well as the color. So a brown or a light brown is perfect.
Yeah, no, I suppose we definitely would have a similar advice, unless there's a back wall prolapse, and if things get stuck, then it's just really important. And that incomplete emptying is always a real sign that things might get stuck into the lower bowels, especially if you have to wipe very frequently, etc. But I know that has to do with formation as well. But it's just really helpful for women to be aware of that, and that it often can get sorted, and they can be taught. They can be taught techniques. There's a lot at the moment, especially with the Zoe studies as well, more about transit time than the sort of old-fashioned Bristol stool chart with all the different stools from Maltesers to other chocolate bar consistencies. Do you look at transit time in your work quite a bit? How much value do you put onto that as a marker?
Yeah. So we do definitely look at things like transit time. It can be something that's quite tricky for someone to monitor themselves. So if you're looking at things like, you know, sweet corn passes through your system more quickly than some other types of foods, for example. But yeah, we definitely look at transit time to some extent, as well as kind of the frequency and the formation, ease of passing, and any other kind of symptoms associated as well.
So, and the Zoe challenge, I think they make people bake blue muffins, don't they?
Yeah.
And then you just check. But sweet corn, the old-fashioned way works just as well. Earlier, quite rightly, I think, or really importantly, you touched on the fact that so many symptoms from the menopause overlap with symptoms which are more specific to the gut. So how does bowel movement digestion change into the menopause?
Yeah. So there's a few things we know from the studies and a few things that we kind of see. So definitely in terms of women, we know women tend to have a slightly slower transit time than men in general, but it slows even more kind of during the perimenopause and the menopause. And so that's one thing that definitely does change. And actually what we want to do is kind of preemptively work on that, or maybe increase some gentle fibers. So one of my favorite ones to increase would be things like chia seeds, because they're a great source of calcium, great source of omega-3, and it's a really nice gentle fiber that you can all kind of very easily add to cereals or salads, etc. So I think one thing that we see changes, the transit time does slow. Women tend a little bit more towards constipation, and actually with the bloating side of things, sometimes all of that bloating can just be linked with constipation. So if you relieve the constipation, you can relieve the bloating without having to look at anything else. Another thing that we see, and it's really interesting, is we know the gut bacteria changes as well with the perimenopause, and there's quite a few studies looking at this now, and looking at actually that you have a increased risk of dysbiosis, which is a negative change in gut bacteria. And there's even some potential associations with things like your gut bacteria, how much it changes, and how early your menopause is. So it's not a direct link yet, but there's potential there. But actually, if you've got a bit more of a kind of a negative change in your gut bacteria, or less varied gut bacteria, then you might be at high risk of like an earlier menopause as well.
Interesting that we slowly start to understand these things a little bit better. Same with joint pains as well. They seem to be one of the very, very early symptoms, not necessarily of an early menopause, but the very, very early symptoms of the perimenopause. And most women just feel rubbish and they don't really relate it.
Yeah, yeah.
or they have a lot of multiple joint pains or gut changes. So it's so helpful that we starting to understand that. So sort of thinking about those gut changes and obviously the movements of the intestines changing as well. I think having a sort of perfect poo is quite a big challenge at any age, but particularly in the menopause. So what's the simple and straightforward dietary advice you can give? And if it's more complex, what to do? You've already mentioned the chia seeds, which I love because it's easy and simple.
Yeah.
You can just chuck it onto something. But would you mind
Yeah,
elaborating a little?
of course. Yeah. So what's really important, I think, as well, when we look at fibers, so one of my top tips for gut health and one of my top tips for going into kind of the perimenopause, the menopause, is to look at the level of fiber you're getting, because we know it's these different fibers that feed your gut bacteria, that help, improve your transit time. They help to bulk your stool, soften your stool, strengthen the muscular walls, etc. And what we really want to kind of step it up from just the chia seeds is to look at a good range of products. So there's a couple things that I like to focus on that I think is really easy advice for most people. So one is diversity, and within that, the different types of fibers as well and portions. So what we know is that if you have more diverse plants within your diet, then it's related to better gut health and an increased level of diversity of bacteria, which is what's linked with improvements in immune health, improvements in mental health, all sorts of areas. And so what you want to aim for, this is like a kind of a step up from the 5 a day, I think, is 30 different plant-based products a week. And so it sounds like loads when you first hear this. I don't know if many people, if you can maybe pop in the chat, if you've heard of this advice before, for 30 different plant-based products a week.
Yeah, well,
I don't know if I can see it.
And it does feel like quite a challenge, isn't it? Because I know some dietitians have done challenges like that, and you have to think about it.
Yeah. Yeah. So some people, you say it and they think, oh my goodness, that sounds like loads. But when you break it down, it's actually, it's not horrendous. So as well as your fruits, your vegetables, it includes your whole grains, so things like your oats, your wholemeal bread, brown rice, quinoa, buckwheat. So it's your whole grains, your fruits, your veggies, your nuts and seeds, and your beans and pulses. You can also count your herbs and spices as like a quarter point if you're really totting it up, but you want to have kind of the bulk from your main 5 fiber groups. And so if you were looking at this across the course of, say, like a day, what I like to do is look at a nice variety and mixture of all of them. So maybe kind of 5 to 7 vegetables if you can, 2 or 3 portions of fruits, at least 1 portion of whole grains. Sometimes for certain groups I might say a bit more, but I would say in the perimenopause at least 1 portion, and then a portion of, say, nuts and seeds plus, and then maybe your beans and pulses a few times a week. So you want to make sure that you're not getting all of your fibers from just veggies, say, because that won't be optimal in terms of stools, in terms of transit time, and all of these other factors.
Interesting. Actually, some really interesting things in the chat, which we will come back to. But a few people have made it up to 27 this week, which I think is
love it.
very, very good. But helpful to know that certain spices and all that diversity and variety helps. It's a bit like with exercise, really. When we talk in our big course about exercise, it always seems to come back to plenty of variety, diversity, keep changing things. So what about often if they eat all the rainbow, all the colors? How relevant is that really?
Love it. Yeah, that's really relevant too. So I think what that's most relevant for is kind of your micronutrient composition. So we know that the colors of your fruits and veggies are kind of indicative of what's within them. So if you're having just green veggies, great, but it's not going to give you all of the micronutrients you want. So really you want to go for it. You eat the rainbow and eat a diverse range of different plant-based products too.
Great. That's so on the whole in our course, Lucy, we are delighted that we got such a good mix of our members of health and fitness professionals. I think particularly for fitness professionals, it can be quite difficult in a exercise setting to ask certain questions, especially about gut health and bowel health as well. What would you suggest in terms of language? And have you got sort of any helpful screening questions or any language that you think is helpful in the group?
Yeah, it's tricky. I would say, because I guess if you're on like a gym floor, etc., you don't want to be having private conversations, or what some people might feel a little bit embarrassed about in front of lots of people. So what I always like to do as well, I mean, I do less kind of group work now, but I used to do a bit more when I was in the NHS, is if people don't want to say it in front of everyone, they can kind of just write it down, or things like food diaries, food and symptom, food and exercise, or food, mood, movement. I like that food diary as well. So kind of writing things down can be really helpful. Or maybe if you've got like 10 minutes before the session to have a quick chat somewhere private before you see them, you know, with a gym floor, for example, that can be really helpful as well. And it might be so much as, rather than directly asking someone, just kind of mentioning, you know, the importance of, you know, checking your stools and things like that. I think as, you know, as people get a little bit older as well, we're looking at things like, you know, regular checkups at the GP as well, and looking out for, you know, warning signs, you know, red flags like blood in your stool and those kinds of, you know, continuous bloating. We want to make sure that all of those red flags are looked out for as well.
Absolutely, and it's so helpful for all of us to increase awareness and then signpost. We, luckily enough, we don't all have to be experts in everything. What did you just mention? Food, mood, and movement. What did you just say?
Yeah, food,
really
mood.
I didn't quite get it.
Food, mood, symptom, movement diary. So that's what I sometimes ask my clients to do. So some people love them, and some people I find them a bit like tiresome writing down everything. But I think if it's someone who's got a lot of different factors, or if their diet's a little bit more complicated, or we're not quite sure, you know, we've kind of made some improvements but we want to make some more, then I think it's a really good way of monitoring and seeing how much things like stress impact your symptoms, or things like sleep or movement as well. Because some people find that actually they go to the gym, and this would be really relevant for the PTs, that maybe after the gym or after going for a run, and they're getting more symptoms, and this could be something like bloating, it could be changes in stools, and it depends on the type of exercise they're doing as well. But generally speaking, if it's endurance exercise, or if it's really intense exercise, then it tends to be drawing more blood away from the digestive tract and to your muscles, so it's much harder to digest your food, and we might need to kind of adapt foods or timings around that as well.
Absolutely, and we'll come back to that in a moment as well, when we're talking about a client we've been working with together. I think that mood side is so important as well, isn't it? So reflecting back on myself, I remember always got huge bloating sort of in the middle of the day after treating, you know, being in clinic, until someone tell me, no, just go for a little walk and breathe for a bit, stand by the river. We're lucky, we're very close to the river, and actually that made such a big difference. So even that 5-10 minutes, just
yeah,
bit of stress
absolutely,
let it all go.
Yeah, and I think it's so, and I always like to touch on it with all of my clients, but some people it's more relevant for than others, and some people really want to talk about it in a bit more detail and others don't. But I think what's really nice is when people notice that change, because I think the kind of the gut brain axis, and we'll get onto this more, but it takes a little bit longer to work on sometimes some things like diet. So whenever I'm making dietary changes, you know, we did them for at least 4 weeks to monitor the effects, but that relaxation, that stress side, it takes a little bit longer, and you need a little bit more consistency, even more than diet, to see those effects and the positive effects come through.
Yeah, what's the app that you recommend again? What's it called?
So there's one called Nerva. So it's Nerva. And I don't know, again, if anyone's heard of this, but it's gut focused hypnotherapy. So just pop it in the chat if you've heard of it, maybe. So again, there's a lot of research behind gut focused hypnotherapy now, and IBS symptoms or gut symptoms. And so this app gives you a little sequence, kind of, not heard of it, 15 to 20 minutes a day, and it's different breathing exercises, techniques, but it's a little bit more gut specific than some of the other apps that you might have heard of, like Mind, Calm, those kinds of things. So yeah, it's not heard of it. Yeah, it's really good.
Yeah. Now that brings us beautifully to my next question, really, about the brain-gut connection. Because I think if you spend quite a bit of time on Instagram in our world, that it's full, it's very popularized at the moment. And there is some really exciting research also about psychiatry and gut health. So, and it's being published, and it's good quality research. But could you, I know it is complex, but could you in a nutshell tell us what it means and how it may impact women more into the menopause?
Yeah, absolutely. So the gut brain axis is kind of a bi-directional connection, or it's a connection between your gut and your brain, and it works both ways. So if you're someone who's having lots of gut symptoms like bloating or changes in stools, we know that can affect some of your stress hormones. You've got cortisol receptors in your gut, you've got serotonin receptors in your gut. So cortisol being related to stress, serotonin, one of your happy hormones. So your gut and symptoms you're having can really affect that, and it's connected to the brain via the vagus nerve. And so even if you're not feeling stressed, your gut can increase stress hormones, which will then increase gut symptoms. It's a bit of a vicious cycle. And equally, if you're feeling that, if you're quite stressed, that can increase gut symptoms, and again, that same cycle. And I think where that's really relevant into the perimenopause is we know that anxiety can be a big symptom. We know that hormonal fluctuations and changes can have a big impact on your mood, and that can then impact your gut, which can then also impact your estrogen levels more. So you have estrogen receptors in your gut as well, lots of them. And so there's kind of a lot going on there, but in a simple form, we know that your gut and your brain are really interlinked, and stress plays an impact on the gut, and the gut plays a big impact on stress.
Yeah, that's beautifully and simplified, beautifully explained in a simple way. And I think it's so relevant to all of us. Like you're just saying, it's true. Even if you don't feel stressed yourself, your gut knows, isn't it? Often when I do have a running race, I think I'm not stressed at all, and I go to Lou, I think, oh yes, I am.
Yeah, no, exactly. It's like the nervous poop, isn't it? Or there's so many kind of little things, and I think it's especially there's a few kind of trials that look at food specifically around this as well, and actually improving your gut bacteria and feeding your gut well can really impact your mood. And so this is so relevant for perimenopause as well, to help stabilize things. So there was a trial that some of you might or might not have heard of called the SMILES trial, which was huge. I think it's a few years old now, maybe 2017 or 2018, and they looked at a group of people, I think it was 60 to 70, and they did 12 weeks. These people had kind of moderate scores of depression, and they looked at changing the diet in one group and not in the other group. They were also on medical treatment, and they found that the group with the changed diet had better improvements and reduced scores of depression. So there's real evidence behind diet improving your mood as well, and I think that's the thing that's so relevant as a preventative measure before we all go into the menopause as well.
Do we already know in terms of micro and macro food groups, what are the food groups we choose, or is that very bespoke and individualized to people as well?
Yeah, so there's a lot of research behind things like Mediterranean diet. So we know your oily fish that's a very well tolerated prebiotic, which is something that feeds your gut bacteria. So oily fish can be really, really helpful. Things like your rapeseed oil, your olive oil as well, rather than the vegetables or the coconut oil. Increasing again the plant-based diversity. These can all be steps to help improve your gut health and your mood. There's also kind of a whole nother level of research, which is, in my opinion, still in its infancy, but looking at things like probiotics and specific strains to help your mood. So there has been some trials looking at these, and they're called psychobiotics. So it's just another term, another name. We've got lots of them now. But really, really interesting area, I think, looking at mood and gut health specifically. So there's some general advice for everyone, and there's potentially a little bit more bespoke advice that could benefit some people.
Yeah, so in terms of evidence occurring, we just watch this space at the moment and see how it
Exactly.
So quite recently we worked together with a good age group athletes who had fear of losing stool during competition, which is really quite common in athletes that continue with competitive sport. Although we probably all can remember the Paula Radcliffe moments in one of the London marathons, wasn't it, when she was young?
Yeah.
So things do happen to your gut when you're doing high level performance. Obviously I worked more on the lower bowel and with her, making sure that it was emptied, and taught techniques in the pelvic floor. Can you tell a little bit more about how you work with her? Because I think that bowel movement is such a silent problem often. Most women that come and see us with bladder issues. And it's not until we ask the bowel issues, which sometimes are the primary cause, it comes up. So I think the more we talk about it and make people aware how important and relevant those symptoms are and how they can often be helped. So would you mind talking a little bit more about this client?
Yeah,
and how,
absolutely.
what steps you advised her to take?
Yeah, so this client was a very high level athlete, as you said, and she, generally speaking, running up to her races, she would reduce the fibers for a few days in her diet, which is perfect because she had no gut symptoms when she wasn't running or competing, but it was just during the runs that she would get lots of urgency and loose stools. And so what we looked at in a little bit more detail were FODMAPs, and there's certain types that are more likely to increase urgency loose stools. So for anyone who doesn't know, I know this is kind of thrown around a little bit more now, lots of people have probably heard of FODMAPs, but it's a group of carbohydrates. So it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And essentially they're one type of fiber. So they go down your entire gut undigested. So past your stomach, past your small intestine, into your large intestine. And this is where some of them draw water into the gut. So in particular, there's 3 groups. So there's one called fructose, there's one called sorbitol, there's one called mannitol. And those are the 3 FODMAP types or sugar types that are more likely to draw water into the gut. And so interestingly, fructose is often added to things like the gels that a lot of athletes will be using. And I think she'd already started to kind of look at that with you as well, Kristen, reducing some of the fructose content in some of her gels or having ones that are just glucose based. So again, when we're looking at athletes and what they can take on, their gut, because like I said earlier, the blood is drawn away from the gut, it's less able to tolerate foods. And so the easy to tolerate gels would be the glucose based ones, because you absorb that quite high up in your small intestine. It doesn't get lowered down and cause that urgency. Whereas gels that have fructose added, in some people it gets a bit lower, you don't absorb it all, and it can cause loose stools, urgency, and races. So what we looked at doing was kind of a 2-week low FODMAP diet, so removing all of these fermentable carbohydrates, which includes a range of fibers, and then testing the groups before runs and kind of during runs as well to see which are affecting her. So yeah, so some really kind of interesting things that you can look at in terms of athletes and gut symptoms.
Yes, and that's great, isn't it? Because I think especially into the menopause and age group athletes is becoming bigger and bigger, and we're all competing into later life. Not everyone, lots of women still, loads of various exercise as well, but we just want to look out for the whole group of the, you know, the people that need a little nudge to start. The ones that don't do much at all, but at the moment, if they start, we get the most benefit. So that's the good news by that group.
Yeah.
Also, with managing the group, that obviously does come across more challenges with age, particularly in acceleration through the menopause with the gut changes.
Yeah. And I think also really interesting, and maybe you touched this in your course in terms of exercise, but what's really interesting and what can be really important for, I think, perimenopausal women is actually looking at increasing any type of exercise, because we know that independently can improve your gut bacteria. And so if you're at high risk of, which all women are going through perimenopause, getting a change in the gut bacteria, that exercise, bringing in more exercise, different types of exercise, can help improve diversity without even looking at diet, which is amazing, I think.
Yeah, no, that's so interesting you're saying that. That's because that's why we ended up calling our big course, Menopause Movement, because most things would go back to exercise again, like good diet, sleep, all the things, you know, movement and exercise does seem to be quite central in starting those processes. Although of course sleep and good diet is just as important. But yeah, exercise can do a lot in itself, and we've got quite a few modules actually into the menopause, how to go about that as well, because again, metabolically those changes with loss of lean muscle mass, and that, you know, that muscle atrophy is exactly what we want to prevent. But absolutely, we keep banging on about that we all want big glutes when we're in our 80s and 90s.
Love it.
No flat bumps.
No, none of those.
That's what we're all aiming. That's
the goal.
So you sort of touched on the FOD diet. How does that sort of tie in with the sort of histamine and antihistamine diet?
So the low histamine diet is quite different. And actually, what I didn't touch on, but I really should have, when I was talking about just kind of diet and improving your gut health generally, are fermented foods. So there's, you know, growing research on things like kombucha, kefir, kimchi, sauerkraut, and in fact improving your gut health as well. So for most women, that's really beneficial. For most people generally, adding a little bit of fermented foods can be beneficial to your diet. But what's different is the low histamine diet. So histamines is a bit of an interesting one, and we've seen it, there's been kind of a growing body of research, and we see it more kind of post-COVID a little bit, and also in perimenopausal women, and it tends to be slightly different from what I would look at of just histamines, because FODMAPs, with FODMAPs we know it just affects gut symptoms, whereas histamines can be outside of the gut as well. So to give you like a bit of a definition, we all have some level of histamines in our body, and we all have an enzyme called DAO for short, and that DAO enzyme helps break down histamines. Now, in some people, that balance slightly changes. So for example, if you have allergies, then you might, your mast cells, they're called, release more histamines into the body, and you have more histamines than your body can break down. And so when you have more histamines than your body can break down, you might notice that as gut symptoms or itchiness or red skin or rashes. And so all foods contain a little, or a lot of foods contain some level of histamines, but for most of us, it's not an issue. However, when you go into perimenopause, for some women, this can be an issue, because we know that rising estrogen levels can increase histamine production. So it might be that foods you could previously tolerate, you can no longer tolerate because of their histamine content. And so because during the perimenopause, you get these erratic kind of changes in things like your estrogen levels, then your histamine tolerance can again change. And so a really good way of kind of, this needs to be done for professional, but just for interest and some indications, histamine intolerance, it can be tricky to diagnose because we know there's so many different, again, overlapping symptoms of the menopause. But if you're someone who maybe had a few symptoms when you started your periods, and so when you first started, that's when estrogen levels are a bit higher as well, then that could indicate that maybe you're at higher risk for histamine intolerance. If you're someone who kind of felt at their best during pregnancy, that's when you have more enzymes to break down histamine. So again, that could be linked. So there's a few little things that we can tie together to see whether reducing histamines in the diet can be beneficial. And if we are to look at reducing histamines in the diet, the idea is that we're not including more than your body can tolerate. So your body can't always tolerate as much as it could do. It's not super common. It's kind of like 1 in 100 or something like that, we think the stats are, histamine intolerance. But if you do have it, then you can work with a dietitian to help reduce the histamines in your diet temporarily and find out then where your tolerance threshold is. So, I mean, with the perimenopause, because you do have those fluctuating hormones, it can be a little bit challenging, but there's different levels of histamine intolerance. And so what I often would initially do is reduce a lot of them in the diet and then test and see kind of what levels we can bring back in. And it might slightly fluctuate if you do have these fluctuating hormones. But what we don't want is a long-term strict low histamine diet, which, to give you a bit of an idea of what this would be, it's reducing all of your fermented or your aged foods. Things like alcohols are all very high histamine. The histamine content in particularly high protein foods, which we know are important in the menopause to retain muscle mass, they can rapidly kind of decay and the histamine levels increase. So it's things like very, very fresh fish rather than fish that's been out on a counter for a while. So there's a few things to look at. It's a bit of a complicated plan, and you only want it to be short term, but that's something that we're seeing a little bit more of in clinic as well.
Well, that's really interesting, isn't it? So it's well, considering estrogen obviously is a regulator of all of that, and we first have all those fluctuations, but then of course that decline as well, which stays stays with us. How does that impact those sort of histamine-based symptoms once the estrogen decline is, pretty low? What would you once women have gone through that perimenopause and they get the flatlining of estrogen, what would you suggest?
So then you should be able to bring some higher histamine foods back into your diet. So you only want it to be temporary plan, but also, as I kind of touched on earlier, those fermented foods, really good for our gut health. Most of us don't want to be long-term having no alcohol at all, because lots of people like to have a little bit. So you only want it to be kind of temporary, and you can always play around with things like histamine. So what I tend to do in clinic is initially do a lower histamine diet, or as low as someone is comfortable with, just short term, then look at bringing a few more foods in, and then give them kind of the tools to be rebalancing that themselves and kind of, playing around a little bit with their diet so that it's as kind of low in terms of restrictions as possible.
Great, that's really helpful. And actually something that I've got to ask you, Lucy, because any time when we talk about diet or bowels or gut is probiotics and prebiotics. I know it's a very, very big topic, but in a nutshell, would you be able to advise us what to look out for and what to leave, kind of not worry about?
Yeah. So it's such an area now. So and you mean anyone who walks into any chemist will see there's such a variety of probiotics. They're kind of spoken about widely. So first of all, just to give a couple like definitions, probiotics are live bacteria. So live bacteria, but we're artificially putting in our gut, and we know that can have a beneficial kind of output in some people. But probiotic supplements, so the tablets that you might take, they're kind of like passengers in your gut. So they'll work and they might have positive benefits for some people whilst you take them, and then they tend to reduce. So if you were to look at someone's gut bacteria whilst they're taking probiotics, there's likely an increase in the strains that you're taking. But if you looked at, if you stopped taking them, then 3 months later, they would have all completely disappeared. So it's kind of a temporary fix almost. And I think for the majority of people, we don't need to take probiotics. So sometimes they can be beneficial, but you want to make sure you have a well-researched brand. It's just temporary and it's got strains that are specific to help you. So often with different types of constipation or different gut symptoms, in some people I'd recommend probiotics for 12 weeks and then usually weaning down, whereas prebiotics are slightly different. So definitely if you're someone who's struggling with gut symptoms, I wouldn't take an artificial prebiotic. So that's the food that feeds your gut bacteria. So whereas the probiotic is like a passenger going down and passing through, the prebiotic is something that will feed your gut bacteria. So you can find these in all sorts of natural foods. So actually all of your high FODMAP foods are prebiotics. So for most of us, if we can tolerate them, we actually want a high FODMAP diet. So foods like garlic and onion and pulses and asparagus, we want lots of those. As a supplement, I'm not a huge fan of prebiotics in most cases. And if you've got gut symptoms, it can make your symptoms worse, just like sometimes FODMAPs can be difficult to tolerate. The false prebiotics also can be. So it's a bit of a ramble. But essentially, probiotics helpful in some people for a short period of time, but I wouldn't take them long term. And it's only in a certain subset. So you want a well-researched brand and specific strains to help you as well.
Brilliant. That's great. That's really, really helpful, actually. What I'll just move on a bit because I'm sure there are lots of questions. I just want to make sure that we've got some time. I think we need to get you back for a whole week because I'm to ask you. And I know, like personally, you're still decades away from the menopause. But professionally or generally in life, what's your main irk about the menopause? How we talk about it, what irks you the most?
Yeah. So I think, what I love, to start with positive, is that it is being spoken about a lot more, and I can see that, and it's great and really important. I think what I probably find the most frustrating is that in terms of nutrition, there seems to be, from what I notice, like a big focus on calcium and cardiovascular health, etc. And I think actually things like the gut symptoms aren't so much spoken about, or improving your gut health generally aren't so much spoken about in relation to the perimenopause. I think that's such an important area. So for me, yeah, that would be it.
Brilliant. Okay, well, we're working on it. That's
yeah, I love it.
Yeah, you've probably already partly answered this question, but what would you like everyone to take away from this chat?
Yeah, so I guess my biggest take home for everyone in terms of working on your gut health is, I think it's something that we can do kind of preemptively. So it's great to work on before you get any symptoms, if you're going to, or before you go into, or at any time. As soon as you can work on your gut health, it's good too. And so it's aiming for those 30 different plant-based products a week, getting a good range of your different fiber types, but also working on the non-diet side to improve your gut health. So things like the movement, sleep, stress relief techniques as well. All of those things collectively, I think.
Yeah, and I think the stress side is always the hardest because we can't change often our stress in life. The good news is that a lot of mindfulness training and a lot of things are effective and they're highly evidenced as well. So it'll never take the stress away in our lives, but it will help us to cope with it and have a slightly different response.
Absolutely. Yeah.
To it. Thank you so much. That was absolutely brilliant. That was so much information. Fantastic. In 45 minutes. So I think it'd be really lovely now because I can see that the chat has been very lively. So I'll hand over to Joe now. And
your quizmaster extraordinaire here with some questions. Okie dokie. There are quite a few comments I'm trying to work through. So starting from the bottom, how common is histamine intolerance in young teens, adults? So that's a non-menopause one, but I guess
that's okay. Gut healthy. So I don't think we have kind of stats, or can't put a complete figure on it, but I would say in terms of how common it is, there are things you can look out for that might make it more common, because it's one thing that it's really hard to test for without looking at the diet, and especially in someone young, you don't want to be restricting diet if you don't need to. So if the kind of person that we're thinking of tends to have allergies, then they have a higher chance of histamine intolerance. Post-illness, post-COVID, maybe a higher chance, but it's really quite rare. So it's most common.
I think actually I've done her a
post-COVID.
disservice. It was in terms, she's added on, it was in terms of linked to estrogen. So
Oh, right. Oh, I see, because I touched on the estrogen rises when you start your period.
Okay.
Yeah, so I would say it's much less common in the younger adult than in the older adult.
Okay, just dipping into the question, does tofu or soya-based products count for the plant-based challenge, please?
Yeah, so I mean, they're definitely fermented foods, which is helpful. So yeah, and I guess it depends on the form that you're eating them in. So if you're having things like edamame beans, absolutely, because really with the plant challenge, what we're looking at is the fibers, whereas things like silken tofu, etc., they're not going to be fibrous, so they wouldn't be.
Okay,
Yeah.
brilliant. I'm rushing on because we've got quite a few. It's like a test, this, isn't it? I think people are asking if there are any lists that you can provide. Several people have said that. Do you have a list or signpost to where we can find suggestions of the foods that you were talking about? So if you let us know, we can drop that in the chat, or if you could send it. I don't want to put you under pressure, but we could always add it to any blog.
So a really good website off the top of my head that's got really nice, great range of different food fact sheets for different conditions, etc., is the BDA, which stands for the British Dietetic Association, which is the governing body of all dietitians. So they've got a whole range of really great food fact sheets that you can.
.org.uk.
I think it might be. Let me just double check.
Don't worry, I'll put it in the chat.
Yeah, if you Google BDA, then it will come up with either British Dental Association or Dietetics. So.
Okay. Are DAO supplements a good idea?
Oh, enzymes. So I would only take those if you're working with a medical professional who's advised them. So I have had clients with histamine intolerance where supplements have helped them, or the enzymes to help them break down histamines can be useful. But definitely I wouldn't just try that on your own. I would work with someone.
Okay, somebody's further question on that. Can you take DAO enzyme to help with histamine intolerance?
If you're working with a healthcare professional who's diagnosed, obviously I can't give out any individual advice, but certainly the low histamine diet can be used, enzymes can be used. But what's really difficult with enzymes is you do want to work with someone who has a lot of knowledge in that area, because you need to get the dosing right, etc. So it's not really something you can go out and buy and treat yourself. You need to work with someone, but they can be helpful, yes.
Okay. Would HRT help or reverse any dietary issues of peri or menopause?
Yeah, tricky. So I mean, I'm not a HRT expert, but in terms of, so interesting with histamines actually is, I think HRT can sometimes, if it's increasing estrogen, then you might find symptoms get worse if you've got a histamine intolerance. But in terms of your other gut symptoms, if you've got hormonally induced bloating, etc., that's often due to a drop. So potentially they can be helpful, yeah.
Great. Well, I'm having a bit of a scroll through. I think we've done most of the questions. People are really commenting and saying, you know.
There was one in the Q&A.
I've done that one. Done it.
Oh, right,
done it. You've passed, by the way. Passed so far. Very pleased with your answers. I'm actually just scrolling through. Just had another one. Somebody said BDA looks like you need to be a member. Are there any sites for patients? Somebody's recommended Megan Rossi.
Yeah. So Megan's great. I actually work with her as well at the Gut Health Clinic. So she's got some bits on her website. We've also got some bits on the Gut Health Clinic website, like blogs. But the BDA, if you Google BDA food fact sheets, they are open to the public as well. So this should be a whole kind of list that you can see.
Brilliant, thank you. Another question: reflux tips? ?
Yeah. So I mean, there's lots that we can look at in terms of reflux, and it depends on your other symptoms as well. But generally speaking, you want to make sure you're not constipated, because if you're constipated, that can increase reflux. And then reflux is usually looking at kind of the pressure in the stomach. So you can adapt things like macronutrients. So I like to say in the evening, going for kind of lower fats if you're getting reflux later on in the evening, and then common triggers, but it's very individual, can be things like caffeine, alcohol, they relax that muscle at the top of your tummy. Spicy foods and citrusy foods can be a bit tricky as well, but it can be very individual. So I'd say maybe test some of these foods without them for 4 weeks and then retry and see how your symptoms are.
What's quite interesting there is, of course, your esophagus is a mucous membrane. Like women complain of vaginal dryness, dry eyes, and the same happens to the lining of your throat, which we often forget. And I was talking to a speech therapist the other day who works a lot with opera singers, and it was really interesting that he said if they're not on HRT, they have to drop an octave, so it changes their voice. So it's just not a thing. And with that, of course, that has an impact on the reflux. Has an impact on the reflux as well. So there's so many things that change with declining estrogen that we sort of forget about, but especially people do high performance stuff like opera singers. That's when it gets high. That's when it gets highlighted. But so it puts them all on estrogen.
So I've missed one here. Sorry. Gut health and anxiety are affected by anxiety and fears. Any advice for controlling the situation? I think that might be what Christine was talking about with stress management tips, maybe. I'm not sure.
Yeah, it's a bit of a tricky one about knowing more about the situation, but I mean, there's definitely lots of people who specialize in kind of gut brain axis work and therapists, but I would say your first port of call if you've got anything uncomfortable with your gut, anything that's affecting your life, is to get some checks with your GP, see some healthcare professionals, and they can then direct you on towards the right avenues for you.
Going further back up the chat. Somebody said some of your, in a polite way, that all of your advice would make them very unwell. I'm intolerant to most nuts, seeds, whole grains, fruits. They set off IBS-D. What about people whose IBS symptoms are made worse by menopause? I had to
great
give you
question
before I asked the question.
Yeah, so that's a really interesting one, and I think what we first of all, if you've kind of had your IBS diagnosis for a long time and you've got lots of kind of intolerances or foods that are really difficult for you to manage, I would definitely encourage you to try little bits of those foods that you don't tolerate. So the advice that I was giving is kind of general for most people, but you might need to slightly change it to suit your symptoms. But what we do know with IBS and intolerances is you can build up your tolerance to all of these foods just by having little amounts, kind of frequently and slowly building. So I would definitely encourage you to try some of those things, especially things like the pulses, because those ones are so good for your gut health. And what you can also do to improve tolerance to pulses are, if you choose things like the tinned pulses rather than the dried pulses, and drain and rinse them really well, just have really small portions within a mixed meal, that will firstly reduce the FODMAP content, because it's likely the FODMAPs you're not tolerating too well. But also when you're having those pulses within a mixed meal, it slows the absorption of the whole meal. So you're less likely to get that kind of hit of that potential sugar that you're not tolerating too well. So I'd really encourage you to try just tiny amounts and then adapt the advice, or work with someone who can adapt the advice for you. That's a bit of a long-winded answer.
And the very last question is, and I've lost it. I've developed, and I'm going to, apologies for pronunciation, GERD through perimenopause. And so when I have a flare-up, Rand's can ear reduces. I'm not actually sure. I think there's a few typos there. Something about ear. Does that make any sense? I'm sorry. It's right up. It's at 1924. So Abigail, if you're there, could you ask the question again? And it's the very last one before I hand over to Anne, and we thank Lucy profusely. No, Abigail's gone. Okay. Sorry, I couldn't, unless anyone, she's back. Oh, okay, last one. Abigail's gone, but somebody said, sorry, the variety of foods I can eat reduces. I have to go back to the other question. Gosh, I'm not very good at this, am I? So when I have a flare up, the number of foods I reduce. Any advice on what I can do to help reflux? Have we already answered that one?
Probably. Yeah, actually, somebody just right at the end, which I think is a really nice thing to finish off with, is sugar not our friends? Would you want give some words of wisdom? Would you mind sharing some words of wisdom around that?
I think sugar's been kind of demonized at points in the press, and it's definitely not our foe. I think little bits are absolutely fine, and I think if you're just having, I mean, sugar in itself, unless it's a specific type like fructose, shouldn't increase gut symptoms. Loads of sugar is not good for your gut health or gut bacteria, but if you're having small amounts, then it's absolutely fine. I think what's also really important, as well as having this lovely nutritious diet that I think is great, is to eat foods that is also working towards your social, emotional health and kind of other areas as well. So a little bit of chocolate now and again, absolutely fine.
Fantastic. Well, Lucy, I'm going to hand over to Anne, but not before we thank you for an amazing, we've had, everybody's been loving it. It's been our best attended webinar today. I just think gut health, I think women are just kind of crying out for information like yours. So thank you very much. I'm just don't know if Anne, you're going to say this, but I know we've had a couple of questions in the chat, so I'm just going to answer it. The event is recorded, but it's recorded for our Menopause Movement members, but it will be available in our webinar shop over on Menopause Movement.